the most dramatic part of your story happened during a family trip that you took to what's supposed to be the happiest place on earth, Disneyland. Tell us about that.
Well, we were taking our daughters to celebrate their middle school graduation. And it was the second day of our trip, and I woke up with a migraine attack. And in those days, I didn't immediately take my sumatriptan or my rescue meds. I took more over-the-counter things and then held those in case it turned into migraine. So it already was becoming a migraine, but I took a lot of medication that day while we were at the park because it was a very busy day. And it was only the second day and I didn't want to ruin our vacation. So I just medicated about every 2 hours. I layered Excedrin, Advil, Tylenol, maybe not Tylenol, maybe even Aleve, and then some sumatriptan. But I thought I was being safe because I was taking it every 2 hours or so. And then that night we got back to the hotel and my stomach was hurting, but I thought I would just go to bed and sleep it off and feel better in the morning. Well, at about 2:30 in the morning, I could just tell this isn't just a regular stomach ache. And I was in tremendous pain. And, as migraine people, we're used to pain, but this was a pain worse than childbirth, worse than anything. And when I got up to try to use the bathroom, I couldn't, I felt dizzy. So I woke my husband up and I said, something's really wrong. We need to go. And I'm not an ER type person. I don't normally go. So he knew I was serious when I said that.
Welcome to our new series, Me versus Migraine, in which we dive into the compelling stories of real people who are battling this disease. Now, in each episode, you're going to take away some insightful nuggets to make living with migraine a little easier and less painful. I'm Paula Dumas, producer of the Migraine World Summit and editor at large at Everyday Health and Migraine Again.
And I'm Carl Cincinnati, founder of the Migraine World Summit and director of operations at Migraine and Headache Australia. In just a minute, you'll meet our friend, Wendy Neary. For the first time, she shares how a family trip to Disneyland ended up with her in the emergency room with a life-saving operation due to a complication from migraine.
And what she's learned through her life-threatening disaster just might save you from experiencing a similar fate.
So I woke up in the ICU. And the doctor spoke with my husband, and he said that there was so much infection in there, and that if I would have waited another 2 hours before coming in, that I wouldn't have made it. So, sorry.
That's incredible, Wendy. I mean, I just want to thank you for your courage in sharing this. It must be difficult bringing up these memories.
It is, but it's good because I don't want this to happen to anybody else. I ended up in that hospital for 10 days, and it was the worst 10 days of my life. I was so weak that I needed to have physical therapy just to walk. And I had to have a nasal gastric tube up my nose into my stomach.
At a certain level, when you take anti-inflammatories and steroids, your own flora, your gut microbiome cannot coexist with repeated uses of OTC like Excedrin, migraine, ibuprofen, steroids for sure. It'll create damage to that lining. And not only the bugs will be damaged, but also the prostaglandin layer that actually is the home for the bugs to grow. So what I tell my patients is if I keep prescribing that to you, how am I ever going to get you to resolve your pain? We might get rid of this acute attack of pain, but what's going to happen 3 months down the road, especially when you get 5 days of steroid? And my concern is that, am I doing more harm than good as a doctor, right? I took that Hippocratic oath, right? I don't want to do more harm than good.
There are several levels of pain to your story. There's the pain of destroying a family vacation and the guilt that comes with that. There's the pain of landing in a medical institution where things are not necessarily done the way you would expect them to be done with a level of professionalism. There's the pain of realizing I could have died. And we spoke to some doctors and they said, yep, with this story, she could have died, right? And you never attach that to migraine.
And so what I would ask everyone is just be careful, be mindful of what you're taking, because you actually can be creating more harm than good.